City's Test and Trace Corps, launched by the mayor's office to help prevent the spread of the coronavirus, has hit the ground running with the new Take Care initiative. So here to tell us more about it is the man overseeing everything, Dr. Ted Long, the executive director of the Test and Trace Corps. So good morning to you, sir. Thank you for joining us.
Good morning. Thank you for having me.
So let's get into it. This was created earlier this month to expand testing as well as identify and isolate New Yorkers, right, who test positive for COVID-19. It's a big, big task that you have ahead of you, and it has to do with the reopening. So how is it going so far?
Yeah, thanks for asking. So we set out to construct this program with three key pillars. We want to test 20,000 New Yorkers every day to give access to you wherever you live. We want to be able to trace who you've been in touch with so we can have a targeted approach for who we further test and how we really control the virus. And then in New York City, it's not as simple as us just telling you to stay home for 14 days. You may not have a private room or a private bathroom, so we're going to get you into, during that phone call where you're being informed that you have the coronavirus, a hotel free of charge, or we're going to figure out with you, with somebody from the community where you live, called a resource navigator, everything you need to be successful staying at home comfortably and keeping your family safe.
So that's part of the Take Care initiative, right?
Correct. That is the Take Care initiative.
So I want to talk about the numbers then as well for this, right? Because the mayor had talked about 1,700 people signing up, and we need to have a certain threshold of tracers to enter phase one of reopening. How are you doing so far in terms of a June 1st deadline? What do the numbers look like?
Yeah, so by June 1st, we said we would have 1,000 tracers on the ground. As I sit here today, we already have 1,700 online. And one statistic I'm going to share with you, because I'm very proud of this, is that almost half of all of those 1,700 tracers are people from the hardest hit communities in New York City who really understand and get the community where they live. And those are the people that are going to be talking to you on the phone.
So let's zero in on that. So you said 1,700 are online, but how many are actually trained and on the ground up and running already?
So they're being trained as we speak, and the set that we're training right now, that 1,700, is going to start working on June 1.
Okay, great. And so when you say that they're going to those hard-hit areas, obviously we saw testing was an issue in some of these neighborhoods, right? There was this whole issue of racial disparities as well that we talked about at length here. So you're saying they will really be deployed to those areas first and foremost?
Yeah, well, so each tracer is going to be stationed in a certain community, and we're putting our tracers that are from the hardest hit communities in their own communities as the trusted people to talk to the people that are either diagnosed with coronavirus in their community or the people that are contacts, so at risk that we really want to reach out to now in their community as well.
Great. So I want to get into what the critics are saying, that the program is a little bit invasive, right? When you might not want to give up somebody's personal information or their contact information of somebody you may have come in contact with if they're not a U.S. citizen, for example, or they're undocumented. So how are you dealing with those concerns?
That's a great question. I'll start by saying New Yorkers have really come together throughout this crisis, and that's why our levels of coronavirus right now are the lowest they've been. They've been going down, down, down. That's because of the strong effort that New Yorkers have put in to keep themselves and their families and other New Yorkers safe. Now, specifically for undocumented immigrants, that's why it's so important to have the people that are calling you be people from your community.
Right.
If it's somebody from outside your community that doesn't understand you or the culture of your community, you're probably going to be less likely to share with them who you've been in contact with, and you're probably going to be less likely to really communicate to them what you need to navigate through coronavirus, which isn't easy yourself. So we have a lot of experience starting the NYC Care program, and we're leveraging that in terms of how to engage with people from their own community.
Yeah, I think that's important. Thank you for pointing that out. And obviously there are a lot of people out of work right now, right? So I want to get to, if in fact you are hiring, how people can apply for these kind of jobs, the experience they need, and the pay here.
Yeah, absolutely. So the experience that you need, first and foremost, we want you to understand your community. Then, if you really understand the community where you live, you're going to be the best tracer. You're who we need. The pay is around, in the range of $60,000 a year, and we have a link that we can share that it goes over all of the pay scale and also gives you the link to apply.
Dr. Ted Long, thank you so much for joining us this morning. I do appreciate your time and explaining this for us, okay?
Thank you for having me.